by Michael McAuliff, Democratic senators recently took a formal step toward reviving President Joe Biden's economic agenda, starting with a measure to let Medicare negotiate prices with drug makers and to curb rising drug costs more broadly. A similar proposal died in December when Senator Joe Manchin decided to oppose Biden's $1.9 trillion Build Back Better bill, which also included provisions allowing for Medicare drug negotiations. Reining in drug costs has long been wildly popular with the public, with more than 80% of Americans supporting steps such as allowing Medicare to negotiate and placing caps on drug price inflation. The bill revealed in early July would do both. It would also limit annual out-of-pocket drug costs for Medicare beneficiaries to $2,000, make vaccines free for people on Medicare and provide additional help for lower-income seniors to afford their drugs. The heart of the bill is the negotiation provisions. Under the legislation, Medicare could start the new pricing procedures next year, with the Secretary of Health and Human Services identifying up to 10 drugs subject to bargaining. The resulting prices would go into effect in 2026. As many as 10 additional drugs would follow by 2029. The plan, expert observers said, was both politically impressive, considering the competing interests at stake, and important for consumers in Medicare, the federal health insurance program for older adults and some people with disabilities, and beyond. They did an amazing job of threading the knee. I mean, it was a Herculean task to get everybody on board on this. Several Democrats in the House of Representatives and Democratic Senator Kyrsten Sinema of Arizona had balked at earlier versions of the drug provisions in the defunct Build Back Better bill, threatening to oppose them or the bill. They agreed with drug industry arguments that limiting profits would stifle drug innovations. Eventually, most Democrats coalesced around a version of the Build Back Better bill. When asked about the bill revealed July 6, a spokesperson for Sinema did not comment directly but pointed to the Arizonans' embrace of the final Build Back Better provisions. Although negotiations between Medicare and manufacturers would focus on a maximum of 20 drugs, they could easily have an outsized impact, Anderson said. A relatively small number of drugs are responsible for a large portion of Medicare Part D spending, he said, and if they tackle those, they w. The bill also would require drug companies to pay rebates if they raise prices too swiftly.